Hi everyone, Dr. Maureen here. Hope everyone's having a great day. Today I wanted to talk a little bit about some menstrual issues today. Kind of mix that up a little bit with all the immune things we've been talking about. So sorry men if you're listening today, but maybe you can tune in for the women you love. But we'll have more content for you coming up. But I want to talk specifically about heaviness or heavy bleeding. A medical term for that is called menorrhagia. But that's really heavy bleeding. And when I mean heavy bleeding, when a woman's having her menstrual cycle, not just a little bit for a couple of days, but I'm talking about soaking through her protection, her tampons, her pads, really quickly, like in an hour. Some women actually need to double up on their protection. Some are passing clots, can be associated with some, pretty heavy pain sometimes too. But some of the causes for heavy bleeding can be just some hormonal imbalance. It can be excessive buildup of the uterine lining, and that can be caused by some hereditary issues or, again, the hormonal imbalances. Some women just genetically make too many inflammatory chemicals, and they have a tendency towards that, and that's something that we'll deal with in our practice, helping them support healthy inflammation levels. We'll have some women who actually have normal hormonal levels and they're still struggling with this. Certain conditions like uterine fibroids and endometriosis can cause it. Women who use IUDs for birth control sometimes can bleed heavier too. So it is important if you're having very heavy bleeding to have a medical checkup with your gynecologist just to rule out any pathology like that. So endometriosis and fibroids, or if you're having a problem, make sure if you have an IUD, you discuss that with your medical provider or your gynecologist as well. When patients come to my office, often they've already been to see their medical doctor, so we're looking at functional problems that could be causing this. So often I'll test the hormonal levels. I also want to make sure there's no problems with the thyroid and the adrenal glands. So we make sure we do a good blood panel to make sure there's no underlying pathology or anything functional going on with the thyroid and adrenal glands. And if there is a problem, we'll make sure that you get a proper referral for that as well and some healthy support. So other things that I'll look at as well is, do we need inflammation support? Do we want to support healthy function of the uterus and ovaries through diet and nutritional supplements? Keeping the diet inflammation low, so making sure we're avoiding processed foods and unhealthy saturated fats, but making sure we're including saturated fats that are healthy, like grass-fed organic butter and coconut oil, because we need those healthy fats. Fats, cholesterol actually help you make your hormones, so we want that. We want to make sure we're having lots of vegetables and healthy proteins as well, but we're getting rid of the processed foods and too much sugar that can really trigger that inflammation. Make sure we're drinking plenty of water. But other things, other than, we'll test adrenal health. It's also important if you're bleeding really heavily to make sure either your medical provider or if you were to come here that we make sure you're not anemic, because that can make it even worse. Believe it or not, if you become iron deficient, you can even bleed heavier, but you're also going to be very fatigued and some of the other health problems with iron deficiency while we're trying to get you healthier, while your medical doctor is trying to address the cause as well. So medically, they may look at birth control pills or something called an ablation, where they actually remove part of the uterine lining. In severe cases, some women may be suggested to have a hysterectomy. But what we like to do is, if we can improve the health and support healthy function around your cycle and healthy hormonal levels, supporting that, often we can help support the woman through this too. Some women in menstruating years will have this, but even women who have normal cycles, but when they're hitting perimenopause, sometimes all of a sudden they'll start bleeding heavy too. There's some different causes for that. So attached to this video, whether you're getting this through Facebook page or through our email, there's going to be a link to a couple quizzes, one for PMS and menstrual problems, and one for perimenopause and menopausal issues too. So you can pick the quiz that seems appropriate for you, and that might give you some clues and some other symptoms that maybe you're struggling with. But always please feel free to reach out. My perspective is, again, just supporting health, using nutrition and nutritional support to support healthy function. One of the things that we do is we like to get those anti-inflammatories in there to help. So we are attaching a wonderful recipe that I make quite a bit for my family, and it's a yummy chicken curry that has a lot of turmeric, which is a really great anti-inflammatory, has coconut milk in it, which is a great healthy fat, and you can use chicken, but you can also put other things in the sub for like shrimp or protein that you like as well in there, but it's a really great recipe, and that'll be attached to this as well. So I hope that was helpful and informative, and know that we are here if you're needing more help. But try diet, more water, clean up the diet, because sometimes that can really help you. Make sure you check in with your GYN as well if you're needing more help, or give us a call here. Have a great day. Take care.